Welcome to this explainer. Okay, today we are actually unraveling a condition that has a completely misleading name, tennis elbow. If you've ever felt this nagging, annoying ache on the outside of your elbow after a long day at the desk, or, struggled with your grip strength when you're just trying to open a jar, well, you are absolutely not alone. Let's dig right into the latest medical science together to figure out what's literally happening under the skin and, more importantly, how to fix it based on the facts.
All right, let's just take a quick look at our roadmap for today. We'll be covering 1. The tennis elbow myth, 2. Beneath the skin, 3. Symptoms and diagnosis, 4. Evidence-based treatments, and finally 5. Recovery and prevention.
Part 1. The tennis elbow myth.
Get this, 5 to 10%. That is the incredibly small number of cases that actually happen in tennis players. Despite that famous moniker we all know, and medically it's known as lateral epicondylitis or lateral elbow tendinopathy, it is genuinely rare for actual tennis players to suffer from this condition compared to the rest of the general population.
So who's actually getting this? Well, the true victims aren't your weekend warriors, they're spreadsheet warriors. We're talking office workers, carpenters, plumbers, chefs, and mechanics. Fundamentally, this is an occupational and overuse hazard. It's an injury that's born from the repetitive gripping of a computer mouse, a wrench, or a heavy frying pan. It's quite ironic, really, that the repetitive, grinding tasks of our modern jobs are the real culprits here, not a weekend racket sport. Moving on to Section 2, Beneath the Skin. All right, so what is structurally going on? The condition zeroes in on a specific tendon called the Extensor Carpi Radialis Brevis, or just ECRB for short. And here is the absolutely crucial distinction. We are looking at microscopic degeneration. The medical term is tendinosis. For a really long time, people assumed this was acute inflammation, hence the itis in epicondylitis. But modern medical science actually tells us it's structural wear and tear of the tendon. This breakdown doesn't just happen overnight, it's this progressive cascade over time. It kicks off with repetitive overload, like gripping that mouse for 8 solid hours a day. Step 2, these tiny microscopic tears develop in the tendon. Then, Step 3, the collagen fibers, which are supposed to be aligned neatly to handle stress, well, they get completely disorganized. And finally, in Step 4, we arrive at degenerative tendinosis. Think of it kind of like a continuously frayed rope. It isn't actively inflamed, it's just structurally tired and weakened.
Section 3. Symptoms and diagnosis.
Let's put this into a real-world perspective. Picture a classic patient, a 40-year-old office worker who slowly, almost invisibly, develops pain on the outer edge of their elbow directly linked to chronic computer use. It's the insidious, everyday nature of desk work that so often leads to these very classic symptoms. Thanks to that frayed rope effect in the ECRB tendon, just normal, everyday tasks suddenly become these painful hurdles. You might feel a sharp pain while gripping, or maybe notice visibly weaker grip strength. You might experience real discomfort during wrist extension, which is literally just the motion of bending your hand back. All of a sudden, turning a simple doorknob, shaking hands, lifting a grocery bag, or having extreme difficulty opening jars becomes your new normal, often paired with some serious morning stiffness.
Now, here's a really important catch. Not all outer elbow pain is actually tennis elbow. While tennis elbow presents as outer elbow pain driven by tendon degeneration, there's another condition called radial tunnel syndrome. That is caused by the compression of the radial nerve, and it feels more like a deep, aching pain. This is exactly why accurate clinical testing by a professional is so vital. You have to make absolutely sure you're treating a tendon issue and not a nerve issue. The really good news here? Diagnosing this is usually totally straightforward. Tennis elbow is primarily a clinical diagnosis. A skilled physical exam using specific provocative movements like Cozen's test or Mills test is almost always enough to confirm that the ECRB tendon is frayed. I really want to reassure you that you can usually avoid unnecessary, expensive, and time-consuming imaging like MRIs right out of the gate. Scans are generally reserved only for highly atypical or extremely persistent cases. All right, Section 4, Evidence-based treatments.
So this brings up a huge question, right? If we know this condition is tendinosis, a structural degeneration, and not just acute inflammation, how in the world do we fix it? Well, we have to pivot our mindset completely away from the myth of anti-inflammatory quick fixes like ice and ibuprofen. Instead, we have to steer directly towards structural rehabilitation. When you actually look at the highest international guidelines from authorities like the American Physical Therapy Association, the AAOS, and the WHO, physical therapy absolutely steals the show as the gold standard. It's highly recommended because progressive loading literally rebuilds the tendon physically. On the flip side, corticosteroid injections, they offer short-term pain relief, but they are actually discouraged for repeated use because they can weaken the tendon tissue over time. And surgery? That's recommended only for persistent refractory cases that just haven't responded to months of proper rehab. Physical therapy is hands down the undisputed winner for long-term healing.
So what exactly does this physical therapy entail? It really boils down to biomechanics, eccentric versus concentric exercises. A concentric exercise is when a muscle shortens under a load. Think of curling a dumbbell upward. But the secret sauce for tendon recovery lies in eccentric exercises. This is when you lengthen the muscle and the tendon while under tension, like slowly lowering that dumbbell back down. It's this specific, slow, lengthening tension that stimulates those disorganized collagen fibers we talked about earlier, prompting them to realign, repair, and ultimately strengthen.
Think about a construction worker, right? Manual laborers with severe repetitive gripping injuries can't just rest their arm for 6 months. They have to get back to demanding tasks. By utilizing targeted progressive eccentric therapy, a patient incrementally builds load tolerance back into that ECRB tendon. It's all about systematically training the arm to handle the heavy real-world demands of the job site again, safely and without risking re-injury.
Section 5. Recovery and Prevention.
Setting realistic expectations here is absolutely crucial because tendon healing, it is a marathon, definitely not a sprint. At the 1-month mark, the goal is really just pain modulation using isometric exercises. By 3 months in, you are deep into that eccentric loading and actively strengthening your grip. But look at that final milestone. It takes 6 to 12 months for full functional return and complete structural tissue remodeling. Your biology simply needs that time to knit those collagen fibers back together properly.
Once you're actually healed up, your absolute best defense is changing your habits to stop that repetitive overload from creeping back in. Set up an ergonomic workplace so your wrists aren't just constantly extended while you're typing. If you do play sports, make sure your technique and your racket grip size are totally dialed in. Keep up with regular forearm strengthening, and honestly, most importantly, allow for adequate recovery time between heavy repetitive activities.
If you take just one thing away from this explainer, let it be this highly optimistic fact. Tennis elbow is highly treatable. It might be incredibly painful and super frustrating, but through conservative, evidence-based, progressive strengthening and smart ergonomic changes, the vast majority of patients recover fully and completely without ever needing to go near an operating room. Your body has an unbelievable capacity to heal itself when given the right mechanical stimulus.
Which brings us to a final thought to leave you with. Ask yourself, how are your daily ergonomics and your regular habits impacting the long-term structural health of your joints? Take a moment today to really look at your workstation, your grip, and your daily repetitive motions. A few small, simple adjustments right now can protect your biomechanical health for decades to come. Thank you so much for joining me on this explainer, and keep learning.